I'm Kate, and I'm here with Dr. Amy Dayries of Aesthetic and Integrative Dentistry. How are you today, Amy?
I'm very well, thank you, and
Thank you.
thanks for talking with me today. I grew up here, so I went to a local public high school. It doesn't exist anymore. It was called Crestwood. Then I went to Emory University and studied chemistry, and then I went to the Medical College of Georgia for dental school.
Great, great. Well, I know one of the things that drew me to your dentistry practice is that you focus on whole body, holistic, and integrative care, and I think that's really fascinating. What drove your interest in this side of medicine?
Oh, that's a good question. It was really a personal journey. I had probably about 10 years ago, I had just had a baby and I got shingles. And so I was in my late 30s and thought, I must be really, really worn down to have gotten so sick. And I realized I was working very hard, pushing myself very hard. And in the unraveling of in reassessing, I think, of your personal identity and your priorities, um, I was physically sick, and then I also had some gut issues. I went to regular doctors and really didn't feel like I was getting answers. I was being told I was okay, and I knew I was certainly not okay. And I didn't want to be just on some sort of a medication. I felt like my diet was becoming more and more limited because of some gut issues I was having. And then I discovered going to an integrative medical doctor who helped me clue in that I had a heavy metal. I had been exposed to heavy metals, probably in part through my work and also from some art hobbies I had had growing up. I had lead and mercury exposure. So I did a chelation therapy program for a while. That it really opened up my world to and my eyes to how I could really probably help patients with more of a whole body experience through the mouth, talking about diet, supplements. This day and time, about 20% of our patients have IBS or tending towards gut issues, and in being able to wrap that into a hygiene appointment, talking about those types of topics, because the bacteria, about half of it in the mouth, is also shared by the gut. So if we can just tie in some of these oral signs that we've always been trained to see and making those to the patient, helping that patient realize it's not just about the mouth, it's really a reflection of the overall body. Part is to the whole. I think we can be a lot more effective, not just with our dental work, but for the patient's overall health.
Well, and that's a great segue into the next question I was going to ask you is what types of things do you see in the mouth that could raise a red flag in your overall health?
Oh wow, there's so many things you can see in the mouth. A lot of times, mild diet, mild vitamin deficiencies. For example, a vitamin B12 deficiency can look like a very rough, fissured sort of red tongue. B1 and B2 can often look like a Joker face. Think of like Batman and the Joker, where they get redness here in the commissures of the lips. Sometimes that can also get superimposed with like a candidal or a yeast infection. So that can tell you a lot about the diet that patient might be enjoying outside of the office, and also maybe what supplements they could take. So those are just a few examples.
Okay, that's wonderful. What do you feel, if you had to narrow down one thing, what the most important aspect of dental health is?
The most important, cutting out inflammation in the mouth. When we can really address the inflammation in the mouth, we're also addressing inflammation in the body.
Okay.
And we connect inflammation so much now to chronic disease throughout the body. So if you come in to see me, I'm not going to just tell you you need to brush and floss better, because that's really just scratching the tip of an iceberg. We really need to be talking with you, engaging with you. We could engage with you on a much deeper level and help you prevent overall disease in your whole body through addressing inflammation in your mouth.
And what would be a few of those things that you would recommend to address the inflammation?
So I frequently will inquire if patient what type of diet they take or eat, talking about sugar and high glycemic types of foods, a glycemic index, having the patient look that up or become aware of that type of term. What else? We talk about probiotics, the types of bacteria that are shared between the gut and the mouth, and how those can produce chemicals or they produce chemicals like lipopolysaccharides that can be absorbed through the gut into the bloodstream that can make people sick, literally sick, or feel depressed, or cause tendencies towards autoimmune disease types issues. There's also a study that connects, there was a study done in one of the Scandinavian countries in 2010 that showed that about half, maybe even up to 75% of heart attacks were related to bacteria that should only be in the mouth. They were finding them on autopsies in people that had died of heart attacks. So cutting that inflammation out is really key. Fish oil is another product. You asked about products. So probiotics and fish oil. Fish oil is really amazing, and that is one of the things I'll suggest.
Okay.
There's other ones too. We start looking at gene deficiencies sometimes in people. Why are they having inflammation if they are trying so hard? And they obviously can try so hard, but they're still having these issues. So why is that? Going back, it's sort of a functional medicine approach.
And so on that note, you offer DNA testing.
Yes.
And that's something that your practice offers that you find important part of the dental experience, I imagine, for preventative care.
Yes, it's amazing for preventative care. For example, there's a very common little gene mutation out there. It's called the mother-father gene, MTHFR, and there's a ton of research that's been done on it that's still coming out about it. It can be tested via a salivary test. It can also be tested with a blood test, but salivary test is a little more gentle and very effective. And if you, for instance, are homozygous for mother-father gene and you had a wonderful big old bowl of spinach salad, you might only absorb like 20% of some of the B12, also B1, B2, and B6, and folic acid that could be in that salad. So and zinc can be an issue too, absorbing zinc. So you could be eating really well, but just not getting out of the food you ate what you should have or what you thought you were getting, and just always running low, because that MTHFR gene is not just a gene title, it's meaning that you don't have enough of an enzyme that converts those vitamins to a usable form. So that is one of the tests that we do.
And you would recommend probably supplements for someone who might be struggling with that?
Yes, we try to do over-the-counter supplements, where the patient gets like a grocery list of things. I do have a couple of things here that I think might be helpful if like you're assisted living or you just don't have time to shop.
Okay.
For convenience purposes. But my goal really is to educate people on what they could be doing at home. You'll need me a lot less if we've got you lined up the way I want you to be lined up. And in the last few years, he's really tried to, as he's nearing retirement age, he's really banded together a lot of the people that want to go from a very natural standpoint, something that's supportive of what the body's already trying to do. People that do the ALF really, I think, love the concept and believe in the concept that the body's always trying to heal itself.
Okay.
And so it looks very small. I had a box in here with one in here earlier. It actually looks sort of like a paperclip that's been wound up, and it feeds behind the back of the teeth, and it draws the tongue up to what we call the spot, or a speech therapist calls the spot. It encourages, in other words, the tongue being up in the roof of the mouth, which is really cool, because you see the tongue is the second muscle that develops after the heart embryologically. And some of the same innervation, the vagus nerve, goes to the tongue that also controls your heart rate. When we find that the tongue is down, as it can be with somebody with a tongue thrust, they might be more likely to have like anxiety or a speech issue. But what it's really doing is it's always stimulating their sympathetic nervous system just a little bit. And an appliance like the ALF, it can draw the tongue up into the roof of your mouth, which will help a person kind of focus better if they have focusing issues or anxiety issues. But it also helps develop the palate and the maxilla. And so it also helps to unwind and straighten teeth. But it's very gentle because it's stimulating bone growth instead of torquing on teeth like braces do.
Okay.
So it can be, some people refer to it as a functional orthodontic appliance. I actually got into ALF because I had previously, a couple of years before that, done something called an oral DNA or a Vivos appliance.
Okay.
And those sort of fall under the umbrella of ALF therapy. They were designed by people that were students of Dr. Nordstrom. And the oral DNA or Vivos appliance is now actually an FDA approved appliance to volumetrically, three-dimensionally, in other words, grow the airway. So what we found is what more and more medical research is showing is that traditional orthodontic therapy to straighten teeth does not always account for the breathing, the airway tube, which is located behind the teeth. And so in a skull, I had a skull I was going to use for this interview, there you have the teeth, and behind the teeth is the oropharynx. And when the teeth have been brought in with retractive orthodontics or like a headgear, it a lot of times will smash or crimp that garden hose airway. And a lot of those people later in life start having sleep apnea or snoring types of issues.
Okay.
So like my kids, when I realized the benefit of these other types of devices, the ALF and the oral DNA, we have not done traditional orthodontics with my own children, because these are taking into account, we want straight teeth, but we also want the maxilla and the bones of the face to develop to their fullest extent. And when you develop a person and support the body in the direction it's trying to go, it's like that person can come completely online. They're not hampered or crimped by something that didn't fully get to grow to its fullest extent.
Okay. That's fascinating.
It's the most amazing. I'll tell you what, when I first went to my first course a few years ago, my plane was late. I was trying to get home from Orlando airport, and I ended up just renting a car. I was so excited, and I was on such a high that this is something we could offer people. It's really life-changing, and it's not just for kids. We were seeing a lot of adults who have had sleep apnea that really struggle wearing a CPAP machine. CPAP machines only have about a 35% compliance rate, so people just give up. But they can wear an oral device that will actually graduate them from needing a CPAP machine. It grows them. It's crazy amazing.
That is awesome.
But it's very well evidence-based medicine. So while we try to do natural therapies, we look at the science and what research is showing is truly effective. We're not just making up stuff at all.
Sure. Well, thank you, Amy, so much
Thank
for your
you.
time today. I really appreciate
Thank you so much.
letting me come in and speak with you. This is Dr. Amy Dayries of Aesthetic and Integrative Dentistry.
Thank you so much, Kate Singh. See you later.
Have a good day.
Thanks.